Dear viewers, today we're talking about an issue almost everyone has faced, yet few discuss openly. It's not just physical discomfort, it can affect your entire daily life, your mood, energy, and work performance. Constipation. There are many misconceptions, embarrassment, and fears surrounding it. In this in-depth discussion, we'll cover constipation from start to finish, from science and psychology to home remedies and medical treatment. What is constipation really? First, understand what constipation is not. It's not only about having fewer bowel movements. You might go every day, but if you have to strain a lot, pass hard pellet-like stool, or still feel uncomfortable afterward, that's also constipation. According to the Rome 4 criteria, if at least two of the following symptoms occur for at least 25% of bowel movements over the last 3 months, it is considered constipation. Fewer than 3 bowel movements per week. Hard stools more than 25% of the time. Excessive straining during more than 25% of bowel movements. Feeling of incomplete evacuation more than 25% of the time. Sensation of blockage in the rectum more than 25% of the time. Needing manual help, like using fingers, to pass stool more than 25% of the time. Our digestive system, an amazing machine. Think of your digestive system as a well-run factory. After food enters, stomach turns food into semi-liquid. Small intestine absorbs nutrients. Large intestine, colon, this is where the real magic happens. The colon absorbs water and electrolytes to form stool. It contracts 3 to 12 times per minute, peristalsis, slowly moving stool forward. During this journey, water is absorbed, making stool more solid. Normally, when stool reaches the rectum, nerves signal the brain, time to go. When we sit on the toilet, pelvic floor muscles relax and stool is released. In constipation, this smooth process gets disrupted. Types of constipation. 1. Primary/functional constipation, 95% of cases. Slow transit constipation. Colon moves too slowly. Defecatory disorder. Outlet dysfunction, rectal muscles don't relax properly. IBS-C, irritable bowel syndrome. Constipation predominant. 2. Secondary constipation, caused by another disease or condition. 3. Idiopathic, cause unknown. Why does constipation happen? A. Lifestyle causes. Low fiber intake. Not drinking enough water. Physical inactivity. Ignoring the urge to pass stool. Busy life, travel, poor toilets. Diet high in dairy, processed foods, red meat. B. Medical and physical causes. Hormonal imbalances. Hypothyroidism. Slows metabolism and digestion. Diabetes. Nerve damage, neuropathy, affects bowel movement. Pregnancy. Hormones relax muscles. Uterus presses on colon. Neurological disorders. Parkinson's disease. Multiple sclerosis. Stroke. Spinal cord injury. Structural problems. Colon or rectal cancer. Hernia. Diverticulosis. C. Medication side effects. Over 400 drugs can cause constipation, including opioid painkillers, morphine, codeine, antacids containing calcium or aluminum, iron supplements, some antidepressants, blood pressure meds, calcium channel blockers. D. Psychological and emotional causes. Anxiety and depression. Eating disorders. Childhood toilet training trauma. Body image disorders. Complications of chronic constipation. If constipation persists, serious complications can occur. Hemorrhoids, piles. Swollen veins due to straining. Anal fissure. Tear in the anus causing pain and bleeding. Fistula. Abnormal connection between organs. Rectal prolapse. Rectum protrudes outside. Fecal impaction. hard stool blockage, bowel obstruction, medical emergency, fecal incontinence, paradoxical, reduced quality of life, fatigue, poor focus, depression. How to understand what your problem is. 1. Medical history. The doctor will ask about how long you've had symptoms, stool frequency and consistency, using the Bristol stool chart, your diet, medications, lifestyle, family history. 2. Physical examination. Abdominal exam to feel for lumps or blockages. Digital rectal exam, DRE. 3. Tests and examinations. Blood tests, thyroid, calcium, diabetes. Imaging, X-ray, CT scan. Colonoscopy. If over 50 or with concerning symptoms. Colorectal transit study measures stool movement speed. Anorectal manometry tests rectal muscle function. Treatment from natural to medical. A. Lifestyle changes, first and primary treatment. 1. Dietary revolution. Increase fiber. Gradually aim for 25 to 35 grams of fiber per day. Soluble fiber, oats, beans, apples, carrots, holds water in stool. Insoluble fiber, wheat bran, vegetables, nuts, adds bulk to stool. Probiotics. Yogurt, kefir, kimchi pickles. Prebiotics, garlic, onions, bananas, greens. Magnesium-rich foods, leafy greens, nuts, avocado. Healthy fats, olive oil, avocado, nuts. Caution, add beans, cauliflower, broccoli slowly. 2. Become a hydration hero. 2.5 to 3 liters of water daily, varies by person and climate. Warm water/lemon water on an empty stomach in the morning. Herbal teas, peppermint, ginger. 3. Regular exercise. Cardio. Brisk walking, swimming, cycling, 150 minutes per week. Yoga, specifically beneficial poses. Padmasana, wind-relieving pose. Malasana, squat pose. Bhujangasana, cobra pose. Pelvic floor exercises. Kegels especially effective for outlet dysfunction. 4. Establish a toilet routine. Choose a fixed time, usually after breakfast. Go immediately when you feel the urge. Never hold it in. Correct position. Near squatting position, use a small stool under your feet. B. Mind-body connection. 1. Stress management, meditation, deep breathing. 2. Biofeedback therapy, retraining pelvic floor muscles. 3. Cognitive behavioral therapy, CBT especially for chronic constipation. C. Medications and medical treatment. Caution: do not take medication without a doctor's advice. 1. OTC medications. Bulk-forming laxatives, psyllium, isabil, methylcellulose. Osmotic laxatives, lactulose, polyethylene glycol, PG. Stool softeners, docusate sodium. Stimulant laxatives, bisacodyl, senna, for short-term use only. 2. Prescription medications. Prokinetic agents, liboprostone, linaclotide. Serotonin receptor agonist, precalpride. 3. Surgery last resort. Subtotal colectomy, very rare, for specific conditions. Guidelines for specific populations. 1. Constipation in children. Common causes: toilet training, stress, diet. Symptoms: leg crossing, incontinence, stomach ache. Treatment: diet change, positive reinforcement. 2. During pregnancy, prioritize natural remedies. Safe: prune juice, psyllium, lactulose. Avoid cascara, senna, mineral oil. 3. Elderly. Causes: weak rectal muscles, medication side effects, low fiber. Regular routine is crucial. 4. Irritable bowel syndrome with constipation, IBS-C. Low FODMAP diet can be effective. Stress management is essential. Natural and traditional treatments. Ayurvedic remedies. Triphala churna in warm water at night. Isabel husk in cold water or yogurt. Ghee with warm milk at night. Haritaki churna. Homeopathy based on cause. Nux vomica, incomplete urge. Bryonia, dry, hard stool. Opium, long-term constipation. Silicea, severe constipation. Natural tonics. Aloe vera gel. Flaxseed. Chia seeds. Castor oil, short-term use. Prevention, daily habits. 1. Morning routine. Lemon in warm water. 15 to 20-minute walk. Try to sit on the toilet after breakfast. 2. Daytime habits. Walk 5 minutes every hour. Stand up every 30 minutes as sitting for work. Drink enough water. 3. Evening habits. Sit with feet in lukewarm water. Abdominal oil massage, clockwise. Warm milk/herbal tea before bed. When to see a doctor? Seek immediate medical attention if you have 1. Symptoms lasting more than 2 weeks. 2. Severe abdominal pain. 3. Blood and stool. 4. Unexplained weight loss. 5. Family history of colon cancer. 6. New or unusual symptoms. Constipation is not just a physical problem. It is a message about your lifestyle, diet, and mind-body connection. It should not be ignored, but listened to carefully. The good news is, in most cases, simple lifestyle changes can resolve constipation. It is a permanently solvable problem. Your gut is your second brain. When it is healthy, your mind will be healthy, and you will have energy. A functional, healthy digestive system is not just a convenience. It is the foundation of optimal health and happiness. Start increasing your fiber intake today. Add an extra fruit or a handful of vegetables. Share this video. Share it with anyone you know who suffers from this problem. Comment below which home remedy has worked for you. Your experience will help others. Subscribe and hit the bell icon to get more in-depth, research-based health content. Remember, your health is your responsibility. Small, consistent changes lead to big success. A simple digestive system, a light mind, and a healthy life await you. Start today.